Welcome to SubstanceEducation.com's audio presentation, What is Alcohol Addiction? Before beginning this course, you will need to print a copy of the Jellinick curve and the Michigan Alcoholic Screening Test. Copies of these documents are found on our website. You will need them later in the course. So let's talk about a list of topics for this course. In this course, we will discuss reasons why people develop problem drinking, define the disease concept of addiction, show the progression of alcoholism as a disease, differentiate between abuse and addiction, and provide you with the opportunity to think about your relationship with alcohol. At the end of the course, we will provide a list of helpful resources for you to learn more about alcohol addiction. Let's begin by talking about some fast facts. Did you know that 3 in 10 adults are at risk for alcoholism? 18 million adults in the United States have alcohol use disorders. Drinking too much increases chances of injuries. This includes a 50% chance of fatal drowning, burning injuries, and homicides, a 50% chance of severe trauma, such as sexual assault, and 40% chance of fatal car crashes, suicides, and lethal falls. And finally, 1 in 4 children in the United States are growing up in alcoholic homes. Why do people become addicted to alcohol? What seems like a very simple question has a very complex answer. For decades, people have tried to understand and identify the reasons for alcoholism. The most common explanation defines it as a moral, educational, or medical problem. Let's take a closer look at each of these explanations. Prior to the 1950s, society viewed alcoholics as wicked people who lacked values. Their bad decisions were explained away because they were weak people who could not resist temptation. Science now tells us that alcoholism is much more than lack of willpower or a character defect. Some believe that alcoholism is, at least in part, due to a lack of information. The person has not gained important information about the harmful and sometimes deadly effects of alcohol addiction. Recovery is thought to be based on gaining educational information so that people can choose the right path. Today, education about alcohol and alcoholism is commonly viewed by mental health professionals as an important component of recovery. With that said, however, it isn't the entire reason people become dependent on alcohol. In the 1950s, scientists began viewing alcoholism as a medical problem. Researchers began studying things like our genetics and bodily makeup as possible reasons for why some people become alcoholics and others do not. The disease concept of addiction was born out of the notion that alcoholism is very much like any other disease or illness that requires medical intervention, treatment, and recovery. The disease concept was initially proposed by researcher E.M. Jellinick. In the early 1950s, Jellinick introduced the idea that alcoholism had certain behavioral and bodily symptoms that made it similar to a disease. From his research, he said that there are two different types of drinkers: habitual, symptomatic, excessive drinkers, or substance users and addicts. Later in this course, we will talk about the differences between each type of drinker. Jellinick also developed different phases of alcoholism to help understand its progression. The next slide shows a graphic similar to Jellinick's ideas. At this point, please get out your printed copy of the Jellinick curve. Beginning from the left side, notice the V shape, which starts with the progression of alcoholism and ends with recovery for some people. Included in the slide are things like increase in tolerance, feelings of guilt because of use, physical deterioration, loss of interest, and obsessive drinking. Now, take a moment to look over the handout, Jellinick curve. Today, the medical model disease concept is commonly accepted by mental health and psychiatric health professionals. You may have heard alcoholism called a disease. So what exactly does this mean? The disease concept means that people are genetically or biologically inclined to develop it, that there are common signs and symptoms that indicate a person is struggling with alcoholism, and that, like other diseases, it has a predictable course if untreated. People will develop various physical and mental health complications, and death is possible if not managed. You may have heard that someone abuses alcohol while someone else is an addict. What exactly is meant by these terms? Do they mean the same thing? Alcohol abuse happens when an individual is bothered by the effects of alcohol consumption. For example, a person may simply be concerned about drinking too much, or may have experienced certain life events such as a DUI. A substance abuser does not show certain physical signs such as tremors of addiction or a continual desire to use that is more commonly seen in more serious drinkers. Listen to the words of Levi, a 24-year-old college student. It started when I got a new sales job. My colleagues frequently went out for drinks after work, and I have to admit the lure of the nightlife seemed very appealing to me, especially after my divorce. I went from never drinking to going out and socializing several nights a week. I also started drinking to relieve some stress. I thought, I've worked hard. I deserve this. It wasn't until I started missing work because of hangovers and neglecting my responsibilities as a father that I knew alcoholism was becoming a problem. Addiction occurs when a person experiences a loss of control over drinking. In other words, it is difficult for the person to decide when to quit drinking. Listen to the words of Anita, a 42-year-old professional. When I started drinking, I knew I couldn't stop. I just wasn't content with one or even two drinks. I needed more. I loved the way alcohol made me feel. I was always chasing the buzz. Negative consequences become more frequent. This might include the breakdown of relationships, loss of job, spiritual emptiness, and economic hardships. This persistent problem is a disease of relapse that, if left untreated, it will only get worse. Numerous alcohol-related illnesses can occur, such as cirrhosis of the liver. The person becomes fixated with drinking and becomes only interested in finding the next drink. Alcohol consumption becomes the focal point of the person's life. Anita further went on to say, "I never thought I could become alcoholic. I'm a successful person. I wasn't laying in the gutter with a bottle of beer in my hand. I didn't drink alcohol every day. All of the stereotypes I had heard about alcoholics didn't match who I am as a person. Eventually, my drinking began to get worse. I started drinking vodka in my orange juice in the morning. Alcohol started out as a way to relax me, but eventually it became something that I needed every day just to feel normal. My drinking problem hit home to me when I got my second DUI. I was in a very bad car accident and was in the hospital for almost a month. I almost lost my life, and that really scared me." Are you at risk for developing problem drinking? Knowing how much alcohol is a standard drink will help you understand how much you drink and the risk associated with it. Standard amounts of alcohol include 12 fluid ounces of beer, or about 5% alcohol, 8 to 9 fluid ounces of malt liquor, about 7% alcohol, 5 fluid ounces of wine, about 17% alcohol, and 1.5 fluid ounces of hard liquor, or about 40% alcohol. What is considered low risk? Notice on this chart, if you are male and consume 4 or less drinks in a single day and 14 drinks weekly, then you are considered at a low risk drinking level. If you are female, then drinking 3 drinks or less in a single day and 7 drinks weekly, then your drinking level is low risk. In order to stay at low risk, you must stay within the day and weekly limits. After looking at this chart, consider your own drinking level. How do your numbers compare to the chart? Are you at risk? Although you may be at low risk, caution should still be exercised. Certain factors may put you at risk. These include drinking too quickly, physical health, and age. Older adults, age 65 and older, should stick to no more than 3 drinks in a single day and no more than 7 drinks weekly. So, what are some physical problems that come from alcohol use? Mood, behavioral, and memory problems. Alcohol can cause the brain neurotransmitters to relay information too slowly. Neurotransmitters are chemicals in our brains that carry messages. Disruption to the balance of neurotransmitters can result in mood and behavioral problems, such as sadness, agitation, and seizures. A neurotransmitter called glutamate appears to be particularly affected to even small amounts of alcohol. Researchers think that alcohol interferes with glutamate action, and this causes memory loss. This probably accounts for why some people experience blackouts or amnesia after drinking. Korsakoff syndrome is caused by a decaying of the brain and vitamin deficiency followed by years of alcohol use. This syndrome results in neurological problems, insomnia, confusion, hallucinations, and unsteady balance. Though treatment is available, the prognosis is often poor. Cirrhosis of the liver is another effect of long-term alcohol use and is caused by an increased demand on the liver to metabolize alcohol. It is a progressive disease where liver tissue is replaced by scar tissue, which eventually prevents the liver from functioning properly. Tiredness and loss of appetite are common early symptoms. Swollen belly, forgetfulness, yellowing of the skin or eyes, agitation, and confusion can occur in later stages. There is no known cure for this condition. Treatment consists of medication, dietary changes, and, in some cases, liver transplant. In fetal alcohol syndrome, children are born to mothers who drink alcohol and are at risk for developing fetal alcohol syndrome. Children with fetal alcohol syndrome may be born small, have problems with eating and drinking, experience vision and hearing problems, have difficulty following simple directions, have attention and learning difficulties in school, and may need medical care for their entire lives. How does alcohol affect your life? Now it is time to review the Michigan Alcoholic Screening Test, or what's commonly called MAST. The purpose of this test is to help you to become aware of your alcohol use. This slide will help you score the MAST. Take your test and score 1 point if you answered no to questions 1 or 4. Score 1 point each if you answered yes to any of the following questions: 2, 3, and 5 through 22. Using these numbers, add them together to get a total. So if you scored 6 or more, hazardous drinking or addiction is possible. Evaluation from a qualified mental health care professional may be recommended. Now that you have gotten your score, honestly think about the following questions. What did you notice about taking the test? What surprised you about your results? How does this compare with what you expected? Do you agree with the results? Why or why not? After thinking about your answers, what's the next step? What do you do to take care of yourself? Take some time after this presentation to complete the handout, Questions for Reflection. This is located on our website. If you believe you need help because of a drinking problem, follow the links provided on this page or call 1-800-662-HELP to find treatment. In case of an emergency, call 911 or go to a local hospital emergency room. To find out more information about alcohol or drug addiction, check out the websites located on this page or further review the courses on our website. Our friends Anita and Levi both did get into treatment. And Levi further shared, recovery started for me when I got into recovery. I started group therapy, and at first I felt intimidated. It was scary, and I felt different from others. Eventually, though, it became an important source of support for me. They all knew what I was going through. It felt empowering to me. It felt like home. My advice to anyone struggling with problem drinking is to give therapy a chance. I admit I felt worse before I got better, but in the long run, it was worth it. In this course, we have talked about the disease concept of addiction, the differences between alcohol abuse and addiction, and resources for more information. If you are concerned about your drinking, we hope this information has helped you add your voice to recovery. You have now completed the course, What is Alcohol Addiction? Please return to the website to take the quiz for this course.